my name is Vijita. I'm a Pilates instructor and physiotherapist here at Pilates. And today we are going to be going through some exercises that is okay for you to do after your surgery, which is a total knee replacement.
Before we continue with the exercises, I would like to state some contraindications and also explain some of the conditions and the complications that if you do have them, please don't continue with the exercises below. First, if you have any infections or sepsis after the surgery. Any unsupervised movements may actually cause the infections to spread throughout the body and cause a much bigger problem from your immune system when you're recovering from the surgery. Next up, if you have any deep vein thrombosis, by that I mean any blood clots that was formed within the blood vessels of the leg, or if you have sudden sharp shooting pain in the leg, make sure that you don't continue with the exercises because it's going to cause the blood clot to go into other areas and may be causing even bigger issues again. Next up, if you have had any loosening of the prosthesis or even complex fractures over the surgery site, right after surgery that you're currently getting follow-up from your doctor, make sure that you get any advice from him before you go ahead with any of the exercises following. Lastly, but not the least, if you have had any major blood loss during the operation, and if it's impairing your healing, by that I mean if your suture is not completely healed, and the doctor has advised you against doing exercises, make sure that you don't go ahead with this. So for the first exercise, we will be doing the hamstring stretch. The things you will need is a towel. Think of putting it around of your foot and you can hold it into either of your hands. So from here, the towel is going to be serving a purpose of trying to hold up the weight of your leg as well. So, with lying flat, let's think of bending in one leg on your left side, as I've shown in the picture. This is to avoid any of the strain onto the back. So make sure you're bringing up your operated leg into the stretch, and we're going to bring it up as much as you can until you feel a stretch that's coming down from right in the bottom of your bum all the way down towards your knee. And we're going to try and hold the stretch for about 10 to 15 seconds. And slowly raise it down again. We're going to be repeating this exercise for 3 to 5 times. We are going to be seeing in how it can relax the muscle, and it's also going to assist in terms of how much you can bend the knee later on. So for the second exercise, the setup is similar to the previous exercise. So you keep your non-operated leg bent and you keep your operated leg straight with the towel around the foot and the ends of the towels into either of your hands. So from here, we're going to be starting to bend your operated leg as much as it's possible for you. Ensure that you're not feeling any intense pain or any intense sensations within the knee as well. Go to a comfortable range, and once you're there, make sure that you're holding it for about 5 to 10 seconds, and you're going to repeat that for 10 times. So you go up and down with holding at the very end range. We're doing this so that we can train the muscles in the knee and also the joint to be able to withstand in terms of how much it can bend, and slowly get that used to it and making it easier for you to bend a much further range, getting back to your normal range that was there before the surgery. So make sure you keep doing this and ensure that everything is comfortable. We are not doing anything that is pushing beyond your comfort range. You will feel the front of the knee working as you stretch, because when you bring it up, it is expanding the muscle that is over the surgery site. So that is why it is very important that you're doing it within the comfortable range, especially if you're fresh after surgery. So for the third exercise, we are still performing heel slides, but this time it is without the towel. Why we do this is to improve the independence of your thigh and your knee muscles to be able to pull up the leg of your weight without your arms helping or any assistance from the towel at all, like in the previous exercise. So this time, we are going to be trying to pull it as much as possible towards your bum and keeping it there for about 5 to 10 seconds that you can repeat for 10 times. And here, you can even try to hold it a little bit longer than the basic minimum of 5. So previously, if you were able to hold it for 5 seconds, think of trying to increase to 7 seconds and gradually into 10 seconds as well. You can slowly challenge yourself according to your comfort range, and also a very important point, that you're not feeling any pain on the front, on the back, or even the surgery side that is over your knee. You're going to feel your front thigh muscles helping you here. As for the next exercise, we will be doing straight leg raises. This is to challenge the muscle over the front thigh and making sure that you are able to raise the leg to about 45 degrees without any tension over the lower back, and you're holding this position for about 5 to 10 seconds, and you can repeat this 10 times. If it is too much for you, you can always think of bringing it up and right down again. You would not have to hold it, because this differs in terms of how long have you had the surgery, and you can get stronger as you go by with it. So you're going to be feeling the front thigh muscles, and when it gets stronger, it's going to be helping you to walk more independently without the help of a walker or a walking stick if you are currently using them right now. Next exercise is the single leg bridge. So this is not involving the operated leg, and we are keeping that straight because we want to avoid overloading the knee in a big range of motion. Again, this also depends in terms of how long ago have you had your surgery. So anytime after 2 weeks is okay for you to do it with both legs, but make sure that you're always checking with your doctor before you go ahead with the exercises. So how to do this exercise is we're going to try and raise our bum up all the way to the maximum height, again without feeling any tension over your lower back. This exercise is going to be working your bum, and that is going to be helping in walking and also reducing the effort when you try to get up from a low chair or even your bed. So gradually you're going to feel much stronger and be able to move more independently with this exercise. So this exercise is called one leg up bridge. This is a progression from the previous exercise. We are increasing the load that is to be carried by the bum. So your operated leg is going to come up into a straight leg raise into a 45-degree angle, and you're going to be trying to push your pelvis all the way to the top with your non-operated leg by using your bum. You can go up and down with no holes in between for starters, and from here you can slowly increase the time that you're trying to hold it up. So maybe try with 2 or 3 seconds and slowly increase from there. This exercise is a variation of the straight leg raise. We are going to be doing leg circles here. So to start this exercise, we are going to be lifting our operated leg up into a 45-degree angle. Keep it there and try to draw small circles for about 5 times before you can bring your leg back to the center and you bring it all the way down. You can repeat this for about 10 times, and slowly the progression will be you can try to increase the number of circles that you are drawing, maybe from 5 to 7, and gradually maybe go up to 10 times as well. This is going to be working on the endurance of your front thigh muscles and also the coordination for you to draw perfect circles as you keep going. This is going to be working all parts of the muscle. So this exercise is called lateral leg raise. You're going to be inside lying. You can lie on either sides. If you are lying on your non-operated side, it is okay for you to just lie the way you are. But if you are lying on your operated side, make sure that you're not feeling any discomfort onto the side of your knee or anywhere around the knee as well. You can also think of adding a small thin pillow under the knee or even a folded towel under the knee to be able to pad it up a little bit so the discomfort reduces. So before you go ahead with this exercise, make sure that your hip, knee, and ankle is in a completely straight line here. You can ensure this by lying in front of a mirror that is down all the way to your level, or you can think of lying close to a wall so that you're able to tell if you're rolling forward or back. So from here, you are going to be lifting your top leg up all the way until you are able to make sure that your pelvis is not rolling together as well. It is a pure hip movement and you're going to feel it onto the outer thigh. which is on the side of the line. And from here, once you've lifted it up, you're going to be holding it for 5 to 10 seconds before you can bring it down, and you can repeat this exercise for about 10 times. Doing this exercise is going to be improving the stability of your hip when you are in standing to make sure that you're not sinking towards one side or the other. You're going to make sure that your pelvis is nice and steady, and this muscle really helps to be able to achieve that stability and also the balance, even when you're in standing or walking. So this exercise is called clamshell. We are still in side lying and making sure that if you're lying on your operated side, make sure that you're padding the knee with a bit of pillow or a thin towel here. So before we go ahead with the exercise, let's talk about the position. I want you to think of keeping all of your hip, knee, and ankles straight first before you pull your ankles a little bit closer towards your bum, around the length of where your knee was. So your knee is just going to propel forward, and you're going to be thinking of trying to form the letter V with your legs here. So to go ahead with the exercise, make sure that your ankle is completely closed in, and also your hip. You're not moving this too. This is a pure knee movement, okay? So from here, I want you to think of how a ring box works. You're gonna keep your ankle and your hip like the axles in a ring box. And you're gonna be thinking of opening your knee up and wide, just like how the box opens. You're gonna try and feel over your outer thigh, but in a very tiny position that's very close towards your hip here. So once you feel that, you're going to hold the position for about 5 to 10 seconds before you close back down, and you're trying to repeat this for 10 times. So make sure that you're doing this exercise with a lot of control. We do not want the pelvis to be turning forward and back. You're not going to be going side to side. Make sure that your hip is always steady here. Your ankle is also, especially your toes and your ankle, is going to be maintaining nice and straight as you keep doing this exercise. This is also a great exercise if you previously had knock knees before the surgery. This would be one of the best exercises that you can do. This exercise is called seated leg raise. We will be sitting in a chair, preferably one with a back support, to ensure that your back is steady throughout this exercise. Make sure your hips are relaxed and your feet are kept hip distance apart. We're going to be trying to lift up our one leg as far as you can, and you're going to hold it for 5 to 10 seconds before you land the foot back down. And we're going to repeat this for 10 times. You're going to feel over the front hip muscles, but on a deeper level, as this works the deep muscles of your hips. So for this exercise, what is important is that you are not rolling your back or your pelvis forward and back while you're doing this. It is a pure hip movement. So think of reducing the height that you're bringing your leg up to if you do feel any tension over your back. So it's okay if the height is reduced. Just make sure that your back is kept straight. And also, if you are feeling any cramps over the front hip while you're performing this exercise, it simply means that the muscle is not ready to go through the endurance portion of the exercise. So think of only just lifting up towards the height that you're comfortable with before you're landing it down. This is to ensure that you're not overstraining the muscle or even cause any injuries on the hip or also the knee. You can also think of straightening out your knee a little bit if the range of the knee shown in the video is too much for you. Now this exercise is called seated knee extension. The setup is similar. You are still sitting in a chair. Make sure that your back is close to the back support area. And from here, we're going to be trying to straighten our knee to the front and bring it back down. This works on the front thigh muscles, but closer to the portion of your knee. So this works those muscles to help you straighten your leg as much as possible. Again, this might be difficult or even slightly painful for you as you are recovering from the surgery itself. So make sure you're trying to reduce the range to what you're comfortable with and you're not exerting yourself way too much. And again, an important part here is that when you're straightening your knee, it is very easy for you to lean to the back with your pelvis. So make sure that that doesn't happen. You feel that you're sitting in the same spot and you're not pressing more into the back of the chair. Keep that completely steady before you think of working just the knee. And you can also reduce the height of where you're straightening it towards, especially if you feel your back throwing off. So this exercise again, make sure that you're trying to hold it up for about 5 to 10 seconds before you bring it back down, and you try to do this exercise for about 10 times. And again, if it feels too heavy for your leg to be maintaining at that height, think of just going up and down until you progress further. This exercise is called sitting heel slides. It is similar to the exercise that we did when we were lying onto our back, but this time we're sitting up with a towel or cloth being under the foot as a slider. This isolates in how much your hip is contributing towards the movement, and we're trying to focus more onto the knee. So here, make sure that you're sitting up straight with your back just slightly against the back of the chair, and making sure you're not using that to help with you again, okay? And from here, we're going to be trying to straighten the knee as much as we can, and your foot is going to act on a way that from the base of the foot, you are rising your toes up and letting your heel slide the towel further as you're trying to bring your leg as straight as possible. And from here, we're going to be bending the knee again, and how your foot is going to be reacting is from the heel, it's going to go onto the base of the foot before you let your heel lift off a bit, which kind of looks like a tiptoe motion. Then you get to bend your knee in as much as possible. And we're going to repeat it all the way forward and all the way back for about 10 times here. And we don't have to hold it on either end. We're just going to be trying to make sure that the movement occurs smoothly and you're not feeling any movement over the pelvis or even the hip area. You're only going to feel it onto the thigh and your knee, making sure that you don't feel discomfort on any areas again, either over the surgery side where your stitches are, or even the front back of the knee as well. Make sure that the range is also comfortable to you.